Hi, this is Dr. Kurt Woeller for Integrative Medicine Academy. I want to welcome all of you to this webinar sponsored through Integrative Medicine Academy. I'm Dr. Kurt Woeller. I'll introduce you shortly to Dr. Tracy Tranchitella. The title of this webinar is COVID-19 Immune Function and Strategies for Maintaining Health. So before we get started, I need to go through this. Normally I just have this shown on the slide, but I need to state it, up front, is that this material is not intended to replace the services or, medical advice of a licensed healthcare practitioner. It's not meant to encourage diagnosis or treatment of any disease, including COVID-19. So it's strictly for educational purposes only. So in watching this, you're agreeing any of the information that's being presented here, you're doing things on a personal level, you're working with a healthcare practitioner, all of that, okay? Also, it's important that nobody takes a photo. So you're not taking a photo of a screen off your phone and then sharing individual slides of any of this information, whether it's online or through other social media platforms. Okay, so that's not permitted. There has been some issues in the past where that's happened, not with us, but with other presentations. So I think we're all in agreement there. So I'm Dr. Kurt Woeller. I have been an integrative and functional medicine physician for over 2 decades. I do a lot of clinical education for Great Plains Laboratory. I'm a former lab advisor for BioHealth Laboratory, did that kind of work for almost 10 years with them. And I do a tremendous amount of speaking. I've written a number of books, clinical educator. I'm also a practicing clinician here in the US. I'm the creator of a website called Autism Recovery System. I'll talk a little bit more about that later. I'm also the co-founder, along with Dr. Tranchitella, of Integrative Medicine Academy, which is an online website in training courses in integrative medicine. I've worked with the autism community now for over 2 decades. I also work with patients with autoimmune problems, neurological disorders, etc. Dr. Tranchitella, Tracy Tranchitella, is a naturopathic physician. She too has been a functional medicine doctor for over 2 decades. She'll be joining us here shortly. She does some clinical education work for ZRT Laboratory. She as well was a former lab advisor for BioHealth Laboratory. She's a co-founder of Integrative Medicine Academy and has worked for years with patients with hormone problems, women with health issues, has a lot of experience in autoimmune disorders, as well as gastrointestinal problems, SIBO, irritable bowel, etc. So before we get started with the core content here, I just want to go through a few recommendations for everybody. And that is that it's important to follow in these times, the guidelines set forth by the federal government, including the Centers for Disease Control regarding social distancing and stay-at-home orders. Same thing with our individual states, state and local government rules as well regarding social distancing. And then if you live outside the United States, make sure you're following your country of residence rules and regulations as well. Also, if you are looking to make lifestyle changes, dietary changes, nutritional supplements, you need to be in contact with your personal healthcare provider, okay, regarding things that you're looking to use, whether that's botanicals, whether that's supplements. There can always be contraindications to certain things depending on your particular circumstance. Also, you need to make sure you're staying in contact with your doctor regarding symptoms of either you're having or a family member, and then looking for available treatment options, whether you're to go to the hospital, whether they want you to stay at home. That's things that you need to take care of on your own with them. So this is a tough topic. I mean, this is, the date today is April 9th, 2020. Where are we with things? I just checked just recently, about a half hour ago. I think we're at about 16,500 deaths here in the United States. I know there's many around the world. The numbers are going up every day. It's a difficult time, and certainly this is a a challenging pandemic for all of us on many levels. So both personally, both professionally. But I also want to, kind of comment that I think it's important for all of us, because we're all in this together. As healthcare practitioners, we're in this together with you as patients, clients, and if you're healthcare practitioners out there, wherever you are, whatever you do in your personal and professional life, we are all in this together. It's affecting all of us. But it's important, I think, to keep some things in perspective. And this is not to minimize at all the deaths that are occurring because of COVID-19. And it's a serious infection, for sure. But sometimes it's easy to lose perspective of where we are as a country when it comes to the number of people that live in the United States, about 325 million people, and how many people die each year of heart disease and cancer and drug overdose. I think I saw the last statistics on opiate addiction was something like 50 to 60,000 people die per year. There's thousands of people that die in the United States every year from influenza. So the COVID deaths are going up, and that is tragic and concerning. It looks as though they're not going to be as high as was predicted even a week, 2 weeks ago, and that's a good thing. But there's a lot about this that we just don't know. So much of it's unpredictable. The people who are heading things up on a governmental level, I think on a daily basis, are trying to figure it out. And so I think it's all important for all of us to keep things in perspective and to control what we can control, things that happen within our individual lives, and how we think and how we approach things, as well as within our families and at home. So I'm going to take the first part here is just go through some of the science on COVID and some different things to think about from a health standpoint, and then Dr. Tranchitella is going to join us to go over some things from a lifestyle, what you can, what we're doing as individuals, etc. So coronaviruses as a group are viruses known to cause disease in mammals and birds. In humans, these viruses typically cause respiratory tract infections. And there's a couple examples of coronaviruses. The SARS, the severe acute respiratory syndrome. This was also known as SARS-CoV-1. This was first isolated in 2017 in China. And if you actually go back and look at the data on that infection could have been a pandemic. It became bad enough, and you start to realize how many of these things potentially are out there and could be in circulation in any given year. MERS, which stands for Middle Eastern Respiratory Syndrome, also known as camel flu. They thought early on that it was somehow being passed from camels to humans. That data is a little bit iffy. This was first isolated in 2012. So it didn't spread too far, but it definitely caused a number of deaths. And it looks like probably one of the main animal sources for these coronaviruses are bats. But coronaviruses have been known here in the US, for over 50 years. So this isn't a new phenomena. Obviously what's happening in our world is new. COVID-19, also known as SARS-CoV-2, or some call it the Wuhan virus or the Chinese coronavirus, this was first identified in Wuhan, China, just this late November or so in 2019. So again, it's closely related to the original SARS coronavirus of animal origin in bats. Now, the transmission occurs primarily through droplets from coughing, sneezing, and they're now even talking about talking, for example. So now there's new guidelines on wearing masks, for example, which as of 2 weeks ago, they were saying don't wear masks. So the information is sometimes contradictory. It can be spread by touching contaminated surfaces. So they, try to keep your hands off nose, mouth, eyes, etc. Common sense stuff. So the pathology is pneumonia is quite common, often bilateral. And I read a report actually from a doctor in Italy who, this was a couple weeks ago, that was the prevailing problem, was bilateral pneumonia that led to hypoxemia and then eventually led to ARDS, acute respiratory distress syndrome. So the ARDS scenario is, this is a severe form of respiratory failure. Rapid inflammation in the lungs, rapid breathing, shortness of breath, cyanosis, and there's a significant increased risk of death. I don't know the exact percentages of people who go on ventilators who actually survive, but it's not very high. So by the time you get to being on a ventilator, you're in extremely bad shape, unfortunately. Pulmonary fibrosis, scarring of the lung tissues, is a real concern, and this may end up becoming a real concern for people who've actually survived COVID, if they've had a bad respiratory problem. And we know now that some people get it and have no symptoms. So people who are most vulnerable are individuals 65 years or older, significant risk individuals 80 years or older. Smokers are at increased risk, and it's probably why you are seeing such a significant amount of people in, let's say, in China. It's probably happening in Iran. I was in contact with somebody yesterday who lives in another Middle Eastern country. It's hitting men, even younger men in those countries, pretty hard because the amount of, they're heavy smokers. Anyone with a pre-existing condition, from asthma to chronic respiratory problems to cancer to cardiovascular disease, hypertension carries a risk, so does diabetes, and certainly anyone with an immune deficiency. And so these people absolutely, certainly need to be sequestered. I guess it'll remain to be seen whether we all will have needed to be quarantined. But the pathogenicity of COVID-19 is interesting, and this is true of many of these coronaviruses. It accesses the lungs through something called angiotensin converting enzyme 2. It's an enzyme, but it connects with this through its receptor. And this ACE2 is found throughout the body. It's not just the lungs, it's found in the GI system, which is why some people are having GI problems, small bowel, stomach, for example. This ACE2 enzyme is also found in the heart, it's found in the kidneys. And ACE2 functionally actually helps to lower blood pressure. What it does is it converts a chemical called angiotensin 2, which can have a vasoconstrictive effect, into things called angiotensin 1 through 7, which help with vasodilation. So it can help to lower blood pressure. And so from a mechanistic standpoint, ACE2 actually helps to lower blood pressure. It can help to decrease inflammation, also decrease oxidative stress. But the COVID-19 uses this ACE2 enzyme receptor as an entry point into the lungs. Now, some people are actually on medications called ACE inhibitors, which basically help to kind of drop angiotensin 2 levels throughout. And so these things have been around for a long time. They're actually quite effective blood pressure medications. And so there's been this question going around whether people should stop their ACE inhibitors or perhaps use them strategically. This was a preliminary report. This just came out March 30th. And this was a report actually that was highlighting some research done in Italy. So as of March 2020, from Italy's National Institutes of Health, their research showed that the most common comorbidities in people who did extremely poor with the COVID infection were people with hypertension, diabetes, ischemic cardiomyopathy, and atrial fibrillation. And so the article concluded that, even though there might be some way or maybe, some mechanism that's kind of similar, for example, of how the coronavirus might access the ACE2 enzyme receptor, it was really still felt that patients with hypertension or some other type of cardiac problem where they have been receiving benefit from an ACE inhibiting medication should just stay on it. Because clearly not having blood pressure controlled, or if somebody's had heart failure or myocardial infarction, for example, there's risk of problems that way too. So the article was really kind of talking about the fact that it looks as though these medications are still worthwhile, even in somebody who has a COVID-19 diagnosis. And one thing to keep in mind about all of this information is we often can get very tunnel visioned on one mechanism of action. And this came up, I was reading something a couple weeks ago on an email, this whole debate about vitamin D. Is it worthwhile taking vitamin D because it too might somehow manipulate the ACE2 receptor mechanism? And this was an article that came out in 2017 talking about vitamin D's effect on what's called the renin-angiotensin system, which is where this whole angiotensin 1, angiotensin 2 mechanism is at play with regards to blood pressure regulation. And so they actually did a rat study where they took 6 groups of rats and they divided them up. They had their normal group. They then injected what's called lipopolysaccharide, which is an inflammatory chemical that can be generated because of infection. And lipopolysaccharide can actually trigger inflammation throughout the body. They then gave a certain group of rats vitamin D at different concentrations, and then they combined it with lipopolysaccharide. And the bottom line was that the clinical manifestations, the shallow breathing, the fatigue, bleeding problems that these rats had from a respiratory standpoint were seen when they got injected with lipopolysaccharide. But the overall effect pathologically on their lungs was much reduced when the LPS was paired up with vitamin D at various concentrations. So the conclusion here was that vitamin D does have a regulatory action on the renin-angiotensin system. So it clearly seems to have a beneficial role, or could be, in helping to regulate actually against lung invasion or lung problems from coronavirus, possibly. Okay, so one, and I'm going to talk about a few resources here and as we go through this, but I'm going to share some information from Dr. Shaw. Dr. Shaw is the founder of Great Plains Laboratory. I do a lot of education with Great Plains. He had a webinar a couple weeks ago titled Phospholipase A2 in relationship to coronavirus. So if you want to get, I would encourage you to go watch this webinar as well. And you can do so through Great Plains website. Basically, go to their homepage, go under resources, and then go to webinar, their webinar library. One of the things that Dr. Shaw talked about was this particular test called Phospholipase A2. This is a urine profile that's easy to collect, and it's looking at a chemical called phospholipase A2. And phospholipases are groups of enzymes that break down fatty acids, and they can lead to elevation of inflammatory mediators called eicosanoids, thromboxane, leukotrienes, prostaglandins. The A2 phospholipase is just named for the functional group at which this enzyme works on. Phospholipids actually make up a part of our cell membrane, and that's going to be the cell membrane throughout our body, whether that's the cell membranes in our brain or nervous system, whether it's in our gut, whether it's in our kidneys, as well as our lungs. And I'm going to call it PLA2 from this point forward. But PLA2, it can be produced locally, but it can get transported throughout the body. And it's involved in a wide variety of disorders. It's not a specific chemical that's linked to any one disease, but it can be linked to many different things, from autoimmune problems to brain trauma to cardiovascular illness to inflammatory bowel disease. I see it oftentimes elevated even in autism. And what PLA2 can do is it can actually damage cell membranes. It can denature proteins within cells, and basically overall just disrupts cell function. Bacteria, viruses, candida, clostridia can produce phospholipases. Even insect bites, spiders, for example, mosquitoes, snake bites, many of them have phospholipase enzymes in the venom. And it is something that gets produced, it appears, with coronaviruses. Now, this was an article that this actually came out from the Wuhan Institute of Virology in 2012, and they were specifically talking about hepatitis C virus. And why that's relevant is that hepatitis C is an RNA virus like the coronaviruses. Now, obviously, hepatitis C really damages the liver, but what they were really getting at in this article was that the phospholipase 2 activity in cells helps the cell, or it basically allows for the virus to upregulate itself to become more pathogenic. And that when some type of PLA2 inhibitor is implemented, and there's many different medications and substances that can inhibit phospholipase A2. In this particular case, it reduced the replication of hepatitis C. So what this is implying is that it might also reduce the replication of a coronavirus. So this is an article, again, that came out in the Journal of Virology. And what they're talking about, again, is that coronaviruses, their ability to replicate is dependent upon their ability to rearrange itself within our cells, and utilizing facets from the cell, from the membrane system in our cells, as well as being able to manipulate things at the nuclear level to take advantage. Okay, and so if we somehow could maybe short circuit that process, that might give us a chance in fighting an infection like this. And one of the ways that can occur, again, is by doing things that regulate cell production of phospholipase A2. Again, because the activity is critical for these RNA viruses to replicate themselves. This was an interesting, they actually took a culture cell, this is lung tissue, okay? And so here we can see it's free of virus. The one in the middle is actually MERS, so this is the Middle Eastern respiratory virus, but again, it was a coronavirus. The viruses light up red, and when they infused into this culture cell medium a PLA2 inhibitor, we can see the coronavirus disappeared. So it's pretty clear that the phospholipase A2 system, okay, is a problem. And so, you know, all of these viruses, you know, you could think of them as parasites, right? They get into our cells and they hijack the mechanism of our RNA and DNA, and then they can create different protein structures that create havoc. And at least from a coronavirus standpoint, the manipulation of the phospholipase A2 system seems to play a big deal. In that, again, if we can somehow inhibit that, we might be able to short circuit the replication. But this is where things get from a standpoint of at least what is thought to occur, and perhaps what we might be able to do to try and combat these situations. Once somebody is in a state of acute respiratory distress, well, then that's where they're needing, obviously, emergency medical therapy in order to survive. We're talking about things that we can try to do ourselves to maintain our health. So where does phospholipase A2 act? Well, if you follow this sequence down, okay, phospholipase A2 is right here. Excuse me, not phospholipase A2. There's a chemical called CDP-Choline, and CDP-Choline is a conversion step in the production of something called phosphatidylcholine. Now, phosphatidylcholine is very important in our cell membranes to help maintain flexibility and pliability. It also helps our cells maintain receptor function and the ability to communicate with other cells, like in the nervous system, for example. So primary functions of phosphatidylcholine is a major component of cell membranes. It's essential for nerve function, brain development. It does actually have a removal effect of triglycerides in our liver. It helps with bile production, so it's often sometimes used in people who have sluggish bile or liver function. Interesting that we need plenty of phosphatidylcholine during pregnancy and breastfeeding. So children actually need extra phosphatidylcholine to support growth. The problem is that PLA2, okay, increased phospholipase A2 activity can convert phosphatidylcholine into something called lysophosphatidylcholine, and that can have some problems. Lysophosphatidylcholine, this is actually just a study showing that it induces neuropathic pain. What you need to remember is that this particular compound can trigger inflammation. So here is the chemical structure of phosphatidylcholine, also called lecithin. It contains what's called a hydrophilic head. Okay, so it likes to be in water environments. So if you look at a cell membrane, this is the component that's actually sticking outside the cell. And then it has a hydrophobic tail. So this is part of the chemical that's within the cell membrane. But notice it's got these two hydrophobic tails. One has a little bit of a kink in it. And what phospholipase A2 does is it cleaves off right here that second position, position number 2. That's why it's called a PLA2. A PLA1 would cleave it off at position 1. And when we break that piece off, okay, this can form arachidonic acid. And arachidonic acid is what stimulates prostaglandins, leukotrienes, and other eicosanoids that have a pro-inflammatory effect in the body, including the lungs. Okay, so here's our PLA2, right? And it breaks things down, so it moves to free fatty acids, arachidonic acid. But this is kind of interesting right here, is CDP-Choline, vitamin E, omega-3 fatty acids. Whenever you eat fish, right, one of the things they tell you is sometimes to try to improve fish consumption because you get a healthy supply of omega-3 fatty acids. Excuse me, let me go back. CDP-Choline is an interesting nutrient because it too inhibits phospholipase A2 activity. So CDP-Choline as a supplement is carried by New Beginnings Nutritionals. And it helps to restore, from a nervous system standpoint, can actually help to restore healthy levels of phosphatidylcholine. It helps support myelin production of the brain, and very much involved in healthy neurotransmitters. But from a inflammatory standpoint, what it's doing is it's inhibiting PLA2. So, and the one thing to keep in mind, because people have asked this, well, what happens if I just take choline? It's not going to inhibit PLA2. Okay, so you can take all the choline you want, but it's not going to have the inhibition of the phospholipase A2. You have to be able to get the combination of choline and cytidine 5-diphosphate. It's got to be this combination. That's what does it. Dr. Shah goes through this in great detail in his lecture. So to get more information about that, I want you to go watch that webinar. I use this in autism. It's been used in patients with Alzheimer's. Some of the studies go up to 4,000 milligrams per day, some on average between 1,000 to 2,000 milligrams per day. What Dr. Tranchitella and I are doing on a daily basis is we're taking 250 milligrams twice a day. So there's 60 capsules in the bottle. As a preventative, as a health support, we're taking 1 capsule twice a day. There is no known specific dose for this that would absolutely be known to inhibit COVID-19, or if it would do it 100%. So I can't make that claim, neither can the company, but I can tell you that preventatively, we're taking 1 capsule twice a day. And that would be, I think, probably a reasonable thing even for kids, maybe even just 1 capsule a day. And that would also be, too, in conjunction with a healthy diet, getting omega-3 fatty acids, etc. So please, when you can, go watch this webinar from Dr. Shaw for more information about this topic. I want to say a few things about some stuff that you're probably seeing and probably already have on the internet. The internet can be a wonderful source of information. It can also be a minefield of disinformation. And that can be problematic at these alarming times. And one of these has to do with this notion that ibuprofen is somehow toxic in the presence of COVID. Admittingly, there's still more to be learned from this. But this was the kind of information that hit the internet probably 2-3 weeks ago. There was some reports out of Europe that COVID patients had all tested high for ibuprofen in their system and that these people did much worse. And so the recommendation was everybody needs to take Tylenol. Don't take ibuprofen, or paracetamol, which is also another name for Tylenol. Well, here's the problem, okay? Or here's where this all started. Ibuprofen may boost ACE2 activity, right? Remember, the COVID virus uses the ACE2 as an entry point into the lungs. And so again, when I say may, I mean that. It may, but it's not absolutely known. Some of this is theoretical, and also it looks at things from a very tunnel vision standpoint. Originally, the World Health Organization, I don't remember when, they came out and got this information. They actually had a statement to say, hey, you better lay off ibuprofen. And then they retracted it. As of March 18th, the World Health Organization basically stated that they don't recommend, not using ibuprofen. And some of this actually came out of an article, Lancet, that was earlier in the year. So a couple things to consider with regards to ibuprofen. Well, ibuprofen helps to decrease inflammation by reducing pro-inflammatory prostaglandins, thromboxanes, these inflammatory components here. So if you look at, here's our phospholipase A2. The phospholipase A2 helps to break down phospholipids in our cell membranes, including the lungs. This is brought about by inflammatory signals, an infection of some sort. We form arachidonic acid, right? And then the arachidonic acid can go off in a number of different pathways to create more inflammatory reactions. So ibuprofen can actually be very appropriate for decreasing one of the major pathways of inflammatory derivatives of fat or lipids. And so it may actually be really needed to bring down inflammation. Here's another component of this and why this information can be problematic. Paracetamol is acetaminophen. Another name for that is Tylenol. When you look at the toxicity aspects of acetaminophen, it can be pretty significant. It's been known to induce metabolic acidosis, kidney failure, and death. There are people that can die of taking acetaminophen in excess. It denatures virtually all proteins. It has been a leading cause of liver failure and deaths from overdosing. and it's linked to a wide variety of other things. Dr. Tranchitella will mention a few things about fatty liver disease, just from a lifestyle standpoint. The other thing is, and if you are a parent or you're a practitioner who's working with kids with autism, this is something that's important as well, is that acetaminophen can do a lot of things within the body that have a toxic effect. Okay, so it breaks down into a compound called NAPQI. And NAPQI will deactivate various proteins in the body. It can cause liver damage. It in itself can lead to death. Okay, and we know that we also get arachidonic acid that's produced via activity of acetaminophen. Also, NAPQI can deplete glutathione levels in the body. And glutathione is critically important in liver detoxification, but it's also a major antioxidant in our cells and throughout the body, and that includes our lung cells. One of the reasons that we strongly suggest people do organic acids tests, and the test that I do is from Great Plains Lab, is there's another component of this. And for parents who have tested their kids with autism, we oftentimes see elevated levels of Clostridia toxins. And these Clostridia metabolites can actually block some of the ability to metabolize normally acetaminophen. So if you haven't done an organic acid test in a while, it's worth doing so to just make sure that you or your child may not have Clostridia issues, because that can be a complicating fact or factor, certainly in the presence of acetaminophen. And then just the effect on glutathione is problematic too. So the organic acids test from Great Plains is a fantastic test. And if you've seen this test before, you know it has a lot of markers for yeast and fungal problems, but the bottom of page 1 is markers for Clostridia, right here under the Clostridia bacterial section. There's another component of this, and that acetaminophen, and this is important in autism, but this is important for everybody, is too much acetaminophen is also known to be mitochondrial toxic. It can damage the mitochondria in the cells, the liver and elsewhere. And the mitochondria are what provide and produce the energy substrate that runs our body, runs our brain and nervous system, runs our gastrointestinal system, runs our immune system. So it can actually deplete the chemical ATP. That is our energy currency that we need to fight infection. It's not to sit there and say that it won't reduce fever, it will. Or this, but again, to load up on acetaminophen because of some theoretical concern over ibuprofen certainly has its downside, and for susceptible individuals, including the autism community. I want to talk about a few things in this article. This came out in January 2020, so it went to print in February. And this is potential interventions for novel coronavirus. Now, this is a systemic review in China. And what they did in this article is they went through a number of different nutritional interventions as well as, excuse me a second. I'm gonna have to mute my mic. I'm in the throes of really bad hay fever up where we are. Pollens are pretty intense. So I'm gonna touch on just a few things here, and then I'm gonna let Dr. Tranchitella talk a little bit more about these nutrients. So vitamin A. Vitamin A is an important nutrient. It's actually been called the anti-infective vitamin. It has a lot of influence on the immune system. People who are deficient in vitamin A generally tend to have a weakened immune system. They know that for things like the measles epidemics, they've done studies where kids who are vitamin A deficient have a much higher chance of developing problems secondary to measles. So vitamin A is known to increase what's called the innate immune system. These are white blood cells, or mast cells, NK cells, natural killer cells, and can have a reducing effect on viral replication. Vitamin C, I mean, we could talk for hours on vitamin C, okay? So, but we're keeping it focused on the whole corona situation. According to this article, vitamin C certainly has a supportive role on immune function, can help protect against infection from coronaviruses. There are some physicians throughout the United States who are doing intravenous vitamin C with apparently good results. So it could, we think it's a worthwhile thing to consider from a supplemental standpoint, just as a health maintenance. Interestingly enough, vitamin C actually can have an antihistamine effect. So it's been something that has been seen to help reduce things like stuffy nose or sneezing, for example. We're taking vitamin C on a daily basis. And to keeping in theme with what I just talked about with regards to glutathione, vitamin C actually helps to recycle glutathione. It actually has an effect on what's called lipoic acid. Lipoic acid influences glutathione. So it's a very important antioxidant in the body. And anytime you're sick, well, your antioxidant reserves are going to get tapped. We already mentioned a little bit about vitamin D. Generally, the lower vitamin D levels are in people, the more susceptible they are to infections. We know that these flu viruses and now the coronavirus is hitting in the winter months where people are indoors, they're not getting natural sunlight. Vitamin D deficiency certainly affects people of all ages, but certainly elderly individuals, people who've been infected with the virus, for example. They've done some studies where they were actually looking at cows that were vitamin D deficient, and they were more susceptible to coronavirus severity, and that when they used vitamin D, it had some protective effects. They also looked at vitamin E, and decreased vitamin E, tended to increase infection capacity or severity in cows. We've already know that vitamin E and omega-3 and CDP-Choline have an inhibiting effect on phospholipase A2, which then decreases the production of arachidonic acid, which would then decrease the propensity to stimulate these pro-inflammatory mediators. Selenium. Selenium has always been important with regards to helping with oxidative stress. It appears that selenium deficiency can increase the potential for RNA viruses to mutate, so increasing their virulence, for example. So this article was talking about that selenium supplementation could be an effective intervention. One of the things too about selenium is it helps in the regeneration of glutathione, antioxidant. Well, zinc is getting a lot of play, and deservedly so. It's a very important mineral for all aspects of the immune system. People, animals who are deficient in zinc often have immune dysfunction, not only being able to hold off an infection, but then deal with an infection once it's in the body. It seems to help in diminishing the replication of various RNA viruses. This particular paper talked about the fact that it could inhibit the replication of the SARS, the original SARS coronavirus. There's doctors who are now combining zinc with hydroxychloroquine with very promising effects. So it's important with zinc that you're taking, I think from a health maintenance standpoint, a modest dose, 30, maybe 40, 50 milligrams per day, always paired with copper. Dr. Tranchitella will touch on that too. From just a practical standpoint, zinc is best kept away from calcium supplements because it might impair its absorption. Also, we recommend taking zinc on an empty stomach. Taking zinc, not on an empty stomach. Avoid taking it on an empty stomach. It's best to actually take zinc with some food because it can cause nausea on an empty stomach. Sorry about that. And then this article talked a little bit about hydroxychloroquine and chloroquine. And then interestingly enough, it actually mentioned about lipoic acid, which I thought was pretty interesting because lipoic acid, we know, has a regenerative effect on intracellular glutathione levels. We're hearing a lot about hydroxychloroquine for good reason. It's because it appears to be working. Is it the only thing out there? Is it going to work 100%? Probably not, but there's a lot of compelling evidence now coming out of France and now throughout the United States, where it's a very effective medication. And hydroxychloroquine and these chloroquine medications have been around for a long time, going back to the mid-30s. I actually saw a video the other day of a guy proposing the use of quinine as a supplement, or even just getting like seltzer water, which has some natural quinine in it. That might be supportive. It's probably not going to treat, or it's not going to be effective if you actually have the infection. Unfortunately, we're seeing people politicizing hydroxychloroquine, which is a shame because it, I think, is an important component. And if you understand now about how the coronavirus works with the whole aspect of PLA2, you can now see why hydroxychloroquine could be a good choice. It's an old malarial drug. In fact, probably going back 20 years ago, I actually had gone to India and became extremely ill with what appeared to be malaria. And this kind of medication that was bought locally, I mean, it saved me. I mean, it was dramatic within 24 hours. The thing is that the coronavirus, we know, accesses the ACE2 enzyme receptor. Well, chloroquine and hydroxychloroquine appear to interfere with the ability of the virus to do that. I also saw something where hydroxychloroquine probably changed the pH, the acid-alkaline balance in the cell, which also affected the ability of the virus to replicate. So I'm very happy that there is a push to get this out there. I saw an infectious disease doctor about a week ago who he basically came out and said, listen, in his experience with the 80 patients that he had in using hydroxychloroquine, he says none of them have gone on ventilators. Many of them were out of the ICU within, or a number of them never went to the ICU, and then the others, significantly improved and were out of the hospital within a few days. He felt that the hydroxychloroquine was a game changer. And this was going back a week and a half ago. So, and then I'm going to wrap up here and then hand the mic over to Dr. Tranchitella, but is this whole thing about cytokine release syndrome. You've probably heard about this, also called cytokine storm. This is one of these things that's been circulating through the internet too. Understand that cytokine storm is an intense, severe, systemic inflammatory reaction to an underlying infection. It's actually occurred secondary to certain drugs. And it's where the immune system is just, it's like it's just opening the gates. Interleukin 1, interleukin 6, tumor necrosis factor are massively increased. But this tends to occur at the terminal end of viral diseases. And this is what's essentially killing people, is this, who are on ventilators, is the cytokine storm, this massive inflammatory situation that is uncontrollable. And if you think about what's happening in the lungs, right, you get a respiratory virus into the cells, it causes, a massive immune response, and then things just get out of hand, okay? And so the cells in the lungs become destroyed, and you get accumulation of fluid, and oxygen levels drop. So again, but that's really at the end of an illness. We know that things like elderberry extract, okay, which have been used forever, okay, in herbal, naturopathic, and integrative medicine. Elderberry extract contains a chemical similar to what's found in Tamiflu, a neuraminidase chemical, which inhibits the flu virus. I'm not making any claims that it inhibits coronavirus, but think about what we're dealing with now, right? We're still in flu season. It's known that elderberry can stimulate various cytokines, but that's normal, right? I mean, it's these cytokines that are pro-inflammatory, but they also have a triggering effect on other immune factors in the body. Inflammation is actually a normal part of our immune response. It helps to bring in blood flow, other nutrients into an area. It's just when it becomes excessive and chronic that it's a problem. So elderberry extract has been shown in different studies to, raise cytokine levels, certain ones, by 3 to 5-fold. Okay, a normal infection might rise it 5 to 10-fold. There's studies that show that just intense exercise, running a marathon, might increase it 100-fold. Okay, so the level of increase of cytokines that you're going to get with elderberry extract is not, from anything that I've read, Dr. Tranchitella has researched, or been in our clinical experience or personal use for years, has ever induced cytokine storm. If you or a family member were to become ill with COVID, then maybe discontinuing it might be warranted. There may be some out there who might argue that, but that could be a personal decision you might have with your healthcare professional. So, but again, concerned about taking some elderberry extract on a daily basis is going to cause cytokine storm. We just don't see it. All right, I'm gonna mute the mic here real quick. I'm gonna hand it over to Dr. Tranchitella. She's gonna talk about nutrition and lifestyle guidelines, and then I'll come back on and we'll finish up with some additional thoughts. Hold on one second.
Hi everyone, Dr. Tranchitella here. So as Dr. Woeller said, I'm going to go over just some nutrition and lifestyle guidelines that we can all implement now while we're being quarantined and sequestering ourselves at home. Just a few things to consider while we're living under these, what we call unprecedented times. I know that word has been used a lot. And we're all trying to figure out how to cope with all of this, having a near global economic shutdown, the enforcing of social distancing, and all of these limitations on our activities and how we interact with others and what we can do in our daily lives. So it can be very stressful because we have a lot of fear of the unknown and the unseen, and we have this indefinite timeline, and that can create a lot of anxiety. How you quantify a stressor is basically based on not knowing what to do with it, the unpredictability of it, and not being able to predict when it's going to end. That increases our stress level a lot. So I think it's important for us to acknowledge that we all feel it. We're all in this boat together. And I just want to talk about some ways of maybe approaching this in a more productive and positive way if we can, because we don't have a lot of control over how we're conducting our lives these days. And so I think it's important for us to focus on what we can control and exert control over the things that are most meaningful to us in our daily lives. So the things that we can control, and what I'm going to talk about here today, is the food that we consume, the nutrients that we consume, the news that we watch, how we care for ourselves and others in our family, and how we use our time. So when it comes to stress management, basically dealing with the unknown is stressful. So we want to identify and address what you can control. And so we're going to go over just some guidelines on that today. Try and stay informed with the news, but don't overconsume the news. I think it just adds to our stress. Watch it once or twice a day just to be up on current events and see what's going on, what things are changing, but then try and turn it off and distract yourself with some other things. A lot of us are still working because we're able to work from home. There's a lot of parents out there that have young kids at home that they're trying to school and keep busy without raising their level of anxiety about what's going on in the world. So keeping the news off most of the day, I think, is a good idea. Just catch up when you can, get a summary, and then turn it off. Exercise, I think, is very important. And I did a video briefly last week just talking about the importance of exercise. A lot of us can't get out and do what we normally do. If you go to a gym or a club or you go to different kinds of exercise studios, we don't have access to those anymore. So we need to find ways of exercising at home. And I'm going to speak more specifically about that. There's a lot of things that we can do in our own home that we don't need a lot of equipment for. We just need a little space. Or we can get outside, at least we still can, and we can walk, run, or ride a bike. Now, I don't know, California just mandated that people have to wear masks when they're outdoors now, or anywhere outside of their home, even if they're in their backyard. So it's kind of hard to run with a mask on, but you know what I mean. Just get out and enjoy the sunshine because the weather's starting to warm, everything is getting nice. We're in more of a northern climate and the weather's warming up here. So getting outside, getting a little sun on your body, breathe some fresh air, talk to your neighbors from a distance, and get the dog out of the house, get the kids out, and do some activities. So eat healthy food. I think this is one of the most important things. We should not use this like it's some extended vacation where we're just eating whatever we want, whenever we want. We want to talk about supporting our immune systems and keeping ourselves healthy so that we can reduce our chance of getting infections if we do have exposure. And that starts with the food that you eat and how you take care of yourself. So there's plenty of food in the markets. There's plenty of fresh food. I think early on when all of this was coming up and people were getting really concerned about it, thinking that they were going to have to quarantine and never be able to leave their house, they were stocking up on food. But there's plenty of food in the markets, and there's plenty of grocery services where you can call and get food delivered. So eat healthy food, choose well, eat well, get enough sleep. Use this time at home to get more sleep to support your health and your immune function. If you are forced to be at home and you can't get out and go anywhere, try to maintain a schedule at least. Don't stay up until 1 or 2 in the morning going down that Netflix hole and binging on Netflix shows because you don't have to get up in the morning to be anywhere. I really advise that people still maintain a good solid sleep schedule, and so that you can get up in the morning, get dressed, and get moving, rather than just sort of letting your days and nights merge together. Maintain contact with friends and loved ones. This is one great way to use social media and FaceTime and Skype and all of those things that we have available to us to at least have some screen FaceTime with the people that you care about. So check in with them, see how they're doing, keep each other laughing. And look for opportunity. As I was saying earlier, we're sort of in this forced shutdown, and we can rail against it and get really stressed about it. And I know that people are really struggling out there economically. It's not fun. But we have access to some things that, online and through the internet that can keep us entertained and engaged. There's a lot of great courses available through things like Coursera.com or the Great Courses Plus or Integrative Medicine Academy. And so look for different things that you can do. Are there books that you wanted to read? Is there something that you wanted to learn about? Did you want to try new recipes or getting yourself on an exercise program? There's a lot of things that you can do in a positive way that you can use this time and turn it into something good. All right, so let's talk specifically about exercise. I mean, we all know that exercise is good for us. And what I try to do when I recommend exercise for people is try to remove the excuse of I don't have time. Because there's a lot of things out there that we can do at home that require minimally like 20 minutes. And think about how often you can burn through 20 minutes being on social media or other things that you just, didn't pay attention to, how you burn through that time when you could be using it in a more positive way consistently over time. The benefits of exercise are, number one, mental health. It improves depression, anxiety, mood, memory, sleep, and motivation. And it increases blood flow to parts of the brain that affect mood and motivation and memory. And it helps to reduce the stress response. The type of exercise that has the greatest benefit on enhancing neurotransmitters is aerobic exercise. And I'm not talking about having to go run a marathon or go for a run. A lot of people just don't like doing that kind of exercise, but you can get out and you can walk briskly, as a good form of aerobic exercise. Just do it briskly enough to get your heart rate up, work up a little bit of a sweat, and do it for 20 to 30 minutes. And get out there and you'll definitely feel better. Physical health, I think we all know that exercise benefits our physical health in a number of ways. It increases blood flow, it has cardiovascular benefits, reduces glucose and fasting insulin levels, and it helps to mobilize fat for energy. We know that some of the pre-existing conditions that make a course of COVID-19 really rough for people is underlying hypertension, prediabetes, diabetes, cardiovascular issues. And so all of the lifestyle and dietary choices that have led up to this point not only may make it very difficult for you to withstand a serious viral infection, but also predisposes you for a lot of other illnesses as well. So it really comes back to the basics, which is why I'm talking about the basics today. It's not just about trying to prevent COVID-19. It's everything that leads up to being healthy that makes you more able to withstand a virus or an infection of any kind or any other stressor. So how much exercise is enough? Well, ideally, or even more so if you can, 30 minutes, 3 to 5 times per week of moderate exercise shows improved biomarkers for fitness and cardiovascular benefit. So think about that. 30 minutes is not very much. 3 to 5 times per week, not very much. So most importantly, find something that you like to do. If getting outside and going for a brisk walk, if you live in a nice area and the weather is nice, then do it regularly. Consistency is more important than intensity. So here's some options. If you can't get out, obviously we can't get out and go to gyms and clubs and all of those things. I know that some of the studios around here are streaming exercise classes online. So they're having their instructors do the exercises and just stream them to your computer. So you can still follow along if you want to. You can also partake in some of the other online programs that exist, like Beachbody On Demand. Nike has some free programs out there, Gymondo, and Daily Burn. So find something that you like, and don't be intimidated by all these super fit people in this picture here. They always have somebody who is doing a modified version when they're conducting the class. So you can always follow the person who is doing something at a lighter level until you get to the point where you can maybe increase the intensity a little more. And also just get outside. So for people who are very afraid to go out to the grocery stores, because those are the only places that we've sort of been funneled into. It's really the only place that we can go is to grocery stores where we are buying our essentials, and other stores that are selling essentials. And if you don't feel comfortable going out and doing your grocery shopping and you want to make sure that you have a steady supply of fresh foods, you can use some of these services that are available online. We have around here in Bend, Oregon, Instacart is employing a lot of teenagers right now because a lot of them are unemployed. and they are doing grocery shopping for people, and it doesn't cost very much for a delivery, and they can get everything that you need. Amazon Fresh, you need to be an Amazon Prime member, so a lot of people are Amazon Prime members, so this is another option that is available. Also, there is Walmart Grocery, and if you are a member with Walmart Delivery Unlimited, then the delivery is free. So there are options out there. You can get fresh food delivered to you weekly or every couple of days if need be, so you do have options. Making good food choices. I'm not going to go real deep into this because I think most people have a good idea what good food choices are. We just don't always choose to make them. So focus on fresh foods. There's a lot of fresh produce out there. We don't have a food shortage. All of our supply lines are open. You can get plenty of fresh food. Keep non-perishables on hand, but add fresh veggies. Quality sources of protein at every meal that supports your immune system. Avoid prepackaged and processed foods for convenience. If you're spending a lot of time at home, it's a good time to start cooking. Focus on soups and stews. I'm big on that because I like one-pot meals. I don't like a lot of cleanup, and they're simple. Pick recipes that incorporate lots of vegetables, or you can add a salad to your meals. And try choosing some new recipes while you're at home. Maybe get the family involved, cook some new things that you've wanted to experiment with for a while, but maybe you didn't have time before. You'd like to also avoid an excessive amount of dairy products, which are known as mucus-promoting foods, even if you don't have a dairy allergy. If you've ever noticed, if you drink a glass of milk or you eat some ice cream or you eat some yogurt, if you get sort of that mucus feeling in the back of your throat, one of the things that we're trying to avoid is developing too much mucus. So avoid a lot of dairy products. Also reduce your sugar intake. Sugar and your immune system. We know that in vitro studies show that sugar decreases the ability of white blood cells to mobilize against an infection. I know personally for myself, if I have eaten something that is too sweet, I will get a sore throat almost immediately. So it is a great red flag for me. It really keeps me in check, and I don't eat a lot of sugar or a lot of sweet foods because it sets me off almost immediately. Sugar can also deplete your body of nutrients that are needed to support your immune system. So in your body's effort to try and process and get rid of that sugar, or use it for energy, you're using up a lot of nutrients that could be used in another way. Overconsumption of simple carbs can ultimately lead to a metabolic state that can predispose to infection. So when we were talking about diabetes and prediabetes as being a pre-existing condition that makes it very difficult to deal with the COVID virus, think about your sugar intake and everything that led up to that. Also think about blood sugar balance and that ratio of cortisol to DHEA. If you're a health practitioner out there and you do testing for adrenal fatigue and you're looking at cortisol and DHEA ratios, we want to make sure that we keep those in balance and that we have good blood sugar control, because blood sugar imbalances are a stressor on our system and it stresses our ability to fight infection. Overall, just keep the consumption to a minimum and try and avoid foods and beverages that have an excessively high amount, like desserts and sodas and candies. If you want to do some baking or anything at home and you're following recipes, I often find that you can use less than half of the sugar listed in the recipe and it still tastes very good. Most recipes have too much sugar anyway. Staying well hydrated is really important. This is something that they were mentioning even on the news, trying to keep your mucous membranes moist and continually sip beverages, whether it's water or herbal teas or dilute juice concentrates. Robert, if you're out there listening, you know what I'm talking about. We had a conversation about this. If you're not, I'm not a big fruit juice drinker, and I don't really recommend drinking glasses of fruit juice because it's really concentrated in sugars. But if you get some of the concentrates like pomegranate or grape or cranberry, you can add that. You can add like 1 or 2 tablespoons to a glass of water or some sparkling water. It gives a little bit of flavor and you're getting some good antioxidants with it. You want to stay well hydrated because it helps to support your mucous membranes and allows for them to be more effective. The vision that I always get in my mind when I think about keeping my mucous membranes moist is like, if you've ever seen like a dry lake bed where all of the pieces of dirt have sort of separated out into their own pieces, it looks like a disjointed puzzle. That's kind of like what your mucus cells are like if they're not well hydrated. There's a lot of space in between. So you want to make sure that you stay well hydrated to keep those mucous membranes moist and supple so they serve as a barrier to keep infections out. So if you do encounter something, it doesn't penetrate through. It also helps to keep those mucus secretions thin and easy to expel. So if you do get a respiratory infection, you need to be able to cough up that phlegm and get rid of it so that you can breathe easier. And you know that's the old formula for figuring out how much water or beverages you should consume. You just take your body weight and divide that in half, and that is the number of ounces of water or liquids that you should be consuming through the day. So sleep is really important too. So for those of us working at home, I advise you to take this opportunity to get more sleep. You don't have to get up, you don't have to get out of the house, you don't have to get ready to go anywhere. For those of you working at home, you can kind of set your own schedule, which is great. So really use this as an opportunity to extend your hours of sleep. And I don't mean like sleeping until noon and going to bed at 2 or 3 in the morning. That's not what I mean. I mean, go to bed at your usual time, reasonable time between 10 or 11 p.m. and see if you can extend your sleeping hours. And then when you get up in the morning, you might feel a little bit better and you can start your day that way, feeling a little more rested. Sleep is one of our best resets for stress. It allows your immune system to ramp up while you're resting. So your immune system does its job while we're sleeping in a different way. It also lowers levels of cortisol and catecholamines. It increases human growth hormone and cytokine production and release. Sleep also initiates the adaptive immune response and sets the immunological memory. So all of those little bugs or viruses or molecules or things floating around in the air that you encounter during the day, your immunological memory gets set while you're sleeping so that you can have an appropriate response the next time you encounter that same thing that you encounter during the day. It also decreases your stress hormones, supports cardiovascular health, reduces weight gain and hunger hormones like ghrelin, and it improves your mood and memory. So if you're not a good sleeper or you tend to stay up late and get up early because of work, I would use this as a time to maybe reprogram your sleep patterns so that you can get more sleep. Sun exposure, it's warming up now, and for most of us, it's, you know, it's warm enough to sit outside in the sun. And, you know, maybe the dermatologists out there may not agree with me on this, but I do think some sun exposure on our skin is really important because it does help to support immune function, not only by way of vitamin D production, but by other ways as well. That ultraviolet light in the blue spectrum we know is antibacterial and antiviral. So if you get outside for 15 to 30 minutes and get some sun on your body, it can be immune supportive. But like anything, you know, too much of a good thing can be bad. If you get too much sun, it can be immunosuppressive. So just think about keeping it modest, not laying in the sun for hours, just getting a little sun on your body and not being afraid to feel it on your skin. It's best to get some sun exposure early or late in the day when the sun's rays aren't as strong and without sunscreen to promote the formation of vitamin D. And that's probably where a lot of dermatologists might not agree with me, but historically, sun exposure has been used to fight infections and help people feel healthy. And some of that is through vitamin D production. I think it's amazing that we have the ability to produce vitamin D in our skin in the presence of sunlight. There's a reason for that. Sorry, I had to pause and get a drink. So when I say no sunscreen, I'm saying just for that brief time that you're out there and you're trying to support vitamin D production. If you plan on being in the sun longer than that, you've already acquired the health benefits of that sun exposure unprotected from sunscreen. And if you're planning on being out there longer, then you should put sunscreen on. 20 to 30 minutes on bare skin can produce up to 50,000 IUs of vitamin D. And it really depends on your skin tone. If you have very fair skin and it's in the middle of the summer, you're going to have a higher production. If you have darker skin and you live further north where you don't get the direct rays as much, you might have less production. In supporting our immune system, it also helps to improve the motility of T cells by increasing hydrogen peroxide production, which activates T cell movement. Sun exposure also increases endorphin production, so it also lifts our mood and makes us feel happy. And this is a good article on the benefits of sunlight, a bright spot for human health. So again, it's about balance. I'm not advocating that you go out there and sun yourself until you get burned. You should know your limits. You shouldn't be out there where you're getting sunburned, but no, don't be afraid of getting some sun exposure. All right, so I know Dr. Woeller talked about some of these nutrients to support the immune system. He was talking about vitamin C and vitamin D, vitamin A, zinc, and selenium. And I just wanted to give you some basic guidelines on dosing. We also have that put together on a handout, which I think is going out to all of the people who are listening here today. So this is just some general guidelines on supplement support for the immune system. And I'm going to speak more specifically on the ones that he did not mention. So with quercetin, the dosage for quercetin is about 300 milligrams 3 times a day. It's often combined with vitamin C because it's used quite often to treat seasonal allergies. And so we know that vitamin C also decreases histamine and stabilizes mast cells. Quercetin can do the same. In terms of being antiviral, it sits on cell wall surfaces, so it blocks proteins that allow a virus to dock and enter the cell. So an adequate amount of quercetin throughout the day can help block the entry of a virus into the cell where it can replicate. So it has antioxidant, antiviral, and anti-inflammatory activity. It also decreases pro-inflammatory cytokines and leukotrienes. So what it's doing is interrupting that allergic reaction, the part of the immune system that is more prone to being stimulated in the presence of an allergen. So it increases Th1 and decreases Th2 activity. And you can see this in this little diagram here. Th1 generates immune reactivity against intracellular pathogens like viruses and bacteria. Th2 generates immune reactivity against extracellular pathogens like worms or allergens. So quercetin helps to push it more towards Th1. N-acetylcysteine, this has been commonly used especially for respiratory infections because it has mucolytic properties and it helps to break down biofilms. So for people who have respiratory infections, it can help to break up the mucus and make it more easy to expel. As a preventive dose, 600 milligrams 2 times a day is good. For somebody who has an acute infection, you can do up to 6 to 7 grams daily. I wouldn't do that unless you know that you have a respiratory infection. It has antiviral, anti-inflammatory, and antipyretic activity. Antipyretic means it helps to reduce fever. It inhibits viral replication. That has been proven with influenza. It also supports the synthesis of glutathione, which is one of our major antioxidants. And it helps to limit lung inflammation and damage from viral infections. So this is a good one to have on hand all the time, because if anybody develops a respiratory infection, you want to make sure that they can at least cough things up so they can resolve the infection quicker. Glycyrrhizin, also known as licorice root extract. Glycyrrhizin is the active component. Daily dose 300 to 500 milligrams 2 times a day. It can inhibit viral replication and prevent entry of the virus into the cells where they can proliferate. So it has antiviral properties. It supports maintenance of cortisol levels by inhibiting conversion of cortisol to cortisone. I don't recommend it, and I think any of the members of Integrative Medicine Academy, you know that we don't recommend using this long term if you have hypertension, because it increases the loss of potassium and increases the retention of sodium with long-term use. But it can be used short-term in terms of its antiviral properties. Elderberry extract, Dr. Woeller had talked about this briefly, so I'll just touch on it briefly here in terms of dosing. We do about 1 tablespoon 3 to 4 times a day, and it tastes good. It's really easy to get into your kids because it has a sweet berry flavor. So very easy to take. We know that it has antiviral activity. It inhibits viral proteins that allow entry into the cell where they can replicate. Same kind of ingredient that you would find in some of the antiviral medications like Tamiflu. It also, the neuraminidase allows the virus to replicate. So it inhibits that, so it definitely decreases viral replication. It blocks the viral cycle at several stages of infection, which is why it can be so effective. A lot of the studies show that it blocks certain replication of the virus at these different stages of the infection cycle. So early on in the infection and even in the later stages. So it has an antiviral effect throughout the duration of the illness. And as Dr. Woeller mentioned, it does increase cytokine release, but you know, I think people who develop a cytokine storm are, as Dr. Woeller said, at the end stage of an illness, and probably have a lot of underlying conditions that they do not regulate immune function very well. So there's going to be usually a lot of underlying conditions there that they can't regulate that inflammatory response. It's normal to have an inflammatory response in the presence of an infection. It's when it gets out of control that it's a problem. Resveratrol has also shown to be promising in supporting the immune system. 200 milligrams 2 times a day to reduce inflammation. It has an immune regulatory effect, which is pretty much dose dependent. The lower the dose, a lower dose is stimulatory to the immune system, and a higher concentration tends to reduce immune activity. So this is why it is so useful in so many conditions. It has this regulatory effect on the immune system where it keeps it more balanced. So if it's overreactive, it kind of turns the volume down. If it's underreactive, it turns it up. So this is, again, why it can be useful in so many conditions. DHEA and melatonin. With DHEA, first test to see if you need it. If you have adequate levels of DHEA, I don't advise supplementing. Especially in women who will tend to androgenize it very easily. What this does is supports the balance between TH1 and TH2. So again, going back to look at cortisol DHEA ratios, do you have enough DHEA to balance cortisol? You want to make sure that that's intact. Melatonin can also be very useful, 1 to 3 milligrams nightly. It's a potent antioxidant. It's one of the most potent antioxidants that we produce, that in addition to glutathione, and it enhances innate and cellular immunity. It can also just support healthy immune function in the elderly and immunocompromised. As we get older, we don't tend to produce as much melatonin, and so we not only don't sleep as well as a result, but we have reduced immune activity also. All right, so tests to consider if you want to evaluate some of these markers that we've talked about. Looking at adrenal and sex hormones in saliva can be helpful. ZRT has a female or male saliva profile, number 3, which allows you to look at sex hormones as well as DHEA sulfate and 4 measures of cortisol. Or if you just want to look at cortisol and DHEA, you can just do their adrenal stress profile, and that is also saliva. Evaluating metabolic markers, when we talked about some of the pre-existing conditions that would make having COVID-19 very rough. Looking at things like fasting insulin, C-reactive protein, hemoglobin A1C, triglycerides, cholesterol, and a breakdown of lipids. That can give you a good idea of where you stand in terms of those metabolic markers. Also, to evaluate sleep, doing a sleep balance profile, measuring melatonin in relation to cortisol. This can be done in the urine, and it gives you 4 measurements of melatonin, so you get to see a rhythm of how much melatonin you're producing. And this is great for people who do have some sleep issues, and you're trying to see what exactly physiologically might be underlying that. So I'm going to turn this back over to Dr. Woeller, and he's going to wrap things up. Stay well, everybody, and enjoy your downtime.
Okay, Dr. Woeller back here again. And thanks to Dr. Tranchitella for that really good information. One thing real quickly, I got a few things to share with you. I wanted to mention one thing about hydroxychloroquine again. You know, a lot of stuff's happening, a lot of information's flying around there. It's clearly not a treatment to be used for prevention. It's meant for if people are sick, and certainly we know that it's a medication used for certain autoimmune disorders. It should not be hoarded by anybody. I know in certain states they're blocking certain pharmacies from distributing it. So, but you know, from a mechanism standpoint, it's one of those things that hopefully, knock on wood, can get this thing under control, at least partly. So in summary, you know, I think the reality is for all of us is control what you can control. Try to reduce mental, emotional stress as much as possible. I know as a family, we, you know, our kids are still in the house, and we've been working out together, and we've been watching movies or playing, you know, playing games or whatever, cooking together, you know, exercising, fresh air. I mean, I know we sound redundant, but these are simple things that we can all do that have a significant impact. And then again, maybe consider implementing some of the nutritional strategies that we discussed. So let's go real quickly over some of the lab tests we discussed. So we talked just briefly about the organic acids test from Great Plains. Highly recommend the Phospholipase A2 test to look at phospholipase A2 levels. Vitamin D testing you can do from Great Plains as well. They actually have a dried blood spot. A pretty good way of assessing for mineral levels, even though a hair test is not going to give absolutes for all minerals, for example, it does a pretty good job at giving some assessment of certain things like zinc, lithium, selenium, for example. So pretty easy to do, even easy to do in kids as well. And then Dr. Tranchitella just went over this list of tests from ZRT laboratory. If you're interested in maybe just checking your cortisol and DHEA, they do have their adrenal stress profile. So that could certainly be a place to start. All of these tests are available through a website called Lab Test Plus. If you order tests through Lab Test Plus, they'll come with a written review along with what are called action step suggestions. You can go to labtestplus.com, so you can get the OAT, you could get the ZRT test, you can get the phospholipase A2, a vitamin D test. You can also email to labtestplus@gmail.com for any questions. If you are a parent or a caregiver of an individual with autism, Autism Recovery System has been around for many years. This is a biomedical educational website. It's got articles, videos. There's actually an entire course called Autism Recovery 101. And we have a private forum. So if you have questions about content in this video or other questions related to biomedical intervention, you can reach out to me through this website. I'm trying to get rid of this pen here. If you are a healthcare practitioner, we are launching a new website program called functionalmedicineclinicalrounds.com. This we're really excited about. So in this website is going to be an opportunity for you to have access to us, both myself and Dr. Tranchitella, through a member forum where you can post questions and other members can answer as well. There'll be bi-weekly educational videos from case studies, clinical pearls, lab reviews, research article discussions. As members in this site, you also get discounts on upcoming mastery courses through Integrative Medicine Academy. And then we'll also have the ability to do lab reviews with us. So one-on-one consulting with us through this website. So for more information, you can go to functionalmedicineclinicalrounds.com. The site's not quite live yet, but we're getting close. So we'll let everybody know once it goes fully live. But again, this will be a membership website service program for practitioners who are either doing functional integrative medicine or perhaps already doing it. And this also means alumni of, the mastery courses through Integrative Medicine Academy. And then Integrative Medicine Academy, we have a tremendous amount of online courses as well. We've got courses in autism, toxicity, hormone problems, SIBO. We also have a course launching here shortly on functional medicine called Functional Medicine Mastery. Our courses are very in-depth. So this is a foundational course in functional medicine, but we don't keep it basic very long because the whole point is we want to help you get up to speed to help patients coming to see you, because the reality is the patients that are going to come to see you because you're doing functional medicine often will have very complex health problems. So for more information, you can go to functionalmedicinemasterycourse.com. All of these courses are taught online. And if you think about where we are now with people working from home, and it's difficult to say what the future holds as far as things that will happen in our society, how medicine will change and how it's delivered. There's an opportunity for all of us as healthcare practitioners to be able to reach more people than ever before. So that's something that we'll get into in this course as well. And then we have, if you're interested in organic acids testing, you may know that I teach some training for Great Plains on the organic acid test. We have our own online courses. The Essential Oat Mastery course is learning how to implement or strategize the oat test. And then the Advanced Oat Mastery course is an advanced course on oat interpretation and implementation into practice. So both courses are actually currently going on right now. You can join any of these courses at any time. And then we're also available, both Dr. Tranchitella and I, for private consultations through our private practice at Sunrise Functional Medicine. You can email to scmedicalcenter@gmail.com, and the website for our practice is mysunrisecenter.com. Okay, everybody, we want to thank all of you again. We hope all of you stay healthy and well. We'll make it through this. We have no doubt it's a trying time, but if we stick together, support each other, we'll be able to accomplish a lot of things. So again, I'm Dr. Kurt Woeller for Dr. Tranchitella. Thanks so much. We'll see you soon. Take care.